Child mortality, measured as the likelihood of a child dying between the ages of 0 and 5, is a crucial indicator of a region's policy effectiveness. During the 1990s and the early 2000s, Southern Africa experienced higher child mortality rates due to a lack of understanding of HIV and AIDS.
Failures in policy making was certainly a contributing factor to why Southern Africa had higher rates of HIV/AIDS infection and higher rates of HIV/AIDS deaths compared to other parts of the world. High-profile leaders, including former South African President Thabo Mbeki, were, especially early on within the epidemic, propagators of a sort of AIDS denialism.
While child mortality remains high in Africa, there is positive news. Overall, child mortality has decreased by an impressive 60% since 1990 across the continent. The reduction in child mortality can be attributed to the implementation of good policies and governance practices.
The first is an emphasis on basic day-to-day governance, especially in the provision of service delivery, including in sanitation and clean water. Evidence-based policymaking is a second lesson we can learn. The life-changing benefits of early childhood vaccinations. And as a result, millions of children each year are able to benefit from these vaccines and have not suffered from diseases they would have had. The third policy-making lesson we can learn is the need for governments and international organizations to collaborate with local communities to encourage them to partake in necessary interventions.
A crucial factor in child health outcomes is trust.
What we find is that in areas where there's lower levels of trust, parents were less likely to want their children to have vaccinations. Without trust, governments can't maintain the legitimacy they need to act on behalf of citizens in the first place. In this instance, international organizations, African governments, aid donor countries, local communities and NGOs were willing to put aside their other differences to come together to act decisively on this issue. What that meant was that the political will existed to ensure that the necessary funding and political support was there for interventions such as focusing on improving basic sanitation services, but also in ensuring that there was adequate funding and distribution of vaccines to critical areas.